Imagine you wake up in severe pain. No hospital, no doctor, no medicine, no Google. You are deep in a forest 50,000 years ago, and something is seriously wrong inside your body. What do? Most people assume our ancestors just died, that without modern medicine, any illness was a death sentence. But that assumption is completely wrong, and the evidence we've uncovered in the last few decades doesn't just challenge that idea, it demolishes it. Because ancient humans didn't just survive disease. In some cases, they treated it with a level of sophistication that still shocks modern scientists today. Let's start with the proof, because this story is built on real archaeological evidence, not theory. In 2023, researchers in Borneo discovered a human skeleton dating back at least 31,000 years. The skeleton had a lower leg that had been surgically amputated, cleanly, deliberately. And here's the shocking part. The person survived. The bone had healed, meaning whoever performed this procedure understood how to cut through flesh and bone, control bleeding, prevent infection, and allow the wound to recover over weeks or months. This is the oldest known surgical operation in human history, and it happened 31,000 years ago. Now, think about what that requires. You need knowledge of the human body. You need sharp, precise tools. You need some method of managing pain, because no human being would stay still during an amputation without it. And you need to know how to keep the wound clean. This wasn't luck. This was knowledge, passed down, refined, and practiced. But surgery is just one piece of this story. The most powerful tool ancient humans had against disease was the natural world around them. Ethnobotany, the study of how humans use plants, has revealed something extraordinary. A huge number of plants that ancient humans used for healing have now been scientifically confirmed to contain active medicinal compounds. Willow bark, which was chewed by ancient Egyptians and later by Native American tribes for pain and fever, contains salicin, the compound that modern chemists use to synthesize aspirin. Turmeric, used in ancient Indian Ayurvedic medicine for thousands of years to treat inflammation, contains curcumin, which modern anti-inflammatory research is still actively studying. Artemisia, wormwood, was used in ancient China to treat fevers. In 1972, a Chinese scientist named Tu Youyou extracted artemisinin from this plant, and it became the most effective treatment for malaria in the world. She won the Nobel Prize in Medicine in 2015 for a cure that ancient Chinese healers already knew about 2,000 years ago. This pattern repeats constantly. Modern science keeps rediscovering what ancient humans already figured out through thousands of years of observation, trial, and error. And they didn't just stumble upon these plants randomly. There is strong evidence that prehistoric humans carefully observed how sick animals behaved, what they ate, what they rubbed against, to identify plants with healing properties. This is called zoopharmacognosy, and it's a real documented behavior that continues in animals today. Now, here's where things get genuinely unbelievable. Across thousands of archaeological sites on almost every continent, researchers have found human skulls with holes deliberately drilled or scraped into them. These aren't injuries from battle or accidents. The holes are too clean, too deliberate, and in a significant number of cases, the bone around the hole shows clear signs of regrowth, meaning the patient survived, sometimes for years afterward. This procedure is called trepanation, and it is the oldest known surgical procedure performed on the human skull. Why would you cut open someone's head? The reasons likely varied. Some may have been for head injuries, to relieve pressure from skull fractures. Others may have been for severe, unrelenting headaches, seizures, or mental illness, conditions that ancient people may have believed were caused by something trapped inside the skull. In some regions, survival rates from trepanation appear to have been remarkably high. One study of skulls from ancient Peru found that survival rates climbed from around 40% in early examples to over 80% in later periods, meaning these practitioners were learning, improving their technique, and getting better over time. This is a medical tradition, not a ritual accident. A tradition. One of the biggest questions about ancient medicine is pain. If you're performing surgery, amputations, trepanations, treating wounds, how do you manage pain without anesthesia? The answer is they had it, just not in the form we recognize. Opium poppies have been cultivated since at least 3,400 BCE in Lower Mesopotamia. The Sumerians called it hulgil, the joy plant. Ancient Egyptian medical texts, like the Ebers Papyrus from around 1550 BCE, describe over 700 plant-based remedies, many of which contain pain-relieving properties. Cannabis has been found in ancient burial sites, with clear evidence of being burned and inhaled. Its analgesic properties were almost certainly known. And alcohol, one of humanity's oldest fermented substances, was almost certainly used as a crude anesthetic. Evidence of fermented beverages dates back to at least 7,000 BCE in China. But perhaps the most fascinating pain management tool wasn't chemical at all. In shamanic traditions across every continent, healing ceremonies involved drumming, chanting, dancing, and altered states of consciousness. Modern neuroscience has shown that these practices genuinely affect how the brain processes pain, by triggering the release of endorphins, by shifting attention, and by inducing states of dissociation that reduce pain perception. Ancient humans may not have had morphine, but they understood the mind-body connection with a depth that Western medicine is only now beginning to take seriously. Ancient medicine wasn't limited to the dramatic. It also handled everyday problems with remarkable skill. In Pakistan, at a site called Mehrgarh, researchers found teeth from around 7,000 BCE with perfectly drilled holes. This is the earliest known evidence of dental drilling in human history. The holes were precise, targeted at areas of decay, and showed no signs of post-procedure infection, meaning whoever drilled them understood the need for cleanliness. Broken bones were set and splinted across multiple ancient cultures. Egyptian mummies have been found with splinted fractures that healed cleanly. Prehistoric skeletons show healed breaks with evidence of external support, sticks, bark, cloth, bound around the injury to keep it in place while it healed. These aren't primitive guesses. This is applied anatomy, a deep, practical understanding of how the body works, gained through generation after generation of careful observation. Here's the thing that should really stay with you. For the vast majority of human history, for hundreds of thousands of years, people got sick, got hurt, and had to figure out how to survive without any of the systems we take for granted today. No pharmacies, no textbooks, no clinical trials. And yet, they built a body of medical knowledge so effective that we are still using pieces of it today. Aspirin, artemisinin, surgical amputation, pain management through mental states. They weren't primitive, they were paying attention to nature, to the body, to each other, in a way that, honestly, we've only recently started doing again. The next time you take a painkiller, think about the person 30,000 years ago who first figured out that a specific plant, chewed at the right time, made the pain go away. They didn't have a lab, they had their lives, and that turned out to be enough. Subscribe, like, comment. Which ancient medical practice shocked you the most?